Case 7 is a 60-year-old gentleman who presented with bloody diarrhea, fever, and elevated white count and abdominal pain. He did not have a history of IBD. He had marginal renal function and recently had a bladder infection requiring the use of antibiotics. On physical examination, the patient appeared lethargic. The abdomen was diffusely tender to palpation, and there were guarding in all four quadrants. And white blood count and CRP are elevated. Stool culture and C. difficile antigen testing was pending. Here are some radiographs of our patient. We can see that there are multiple dilated bowel loops. We know these are large bowel loops because we see these haustral markings, which does not transverse through the entirety of the bowel diameter, in contrast to the valvulae conveniente we saw in the prior case. So multiple dilated large bowel loops, especially in the transverse colon here. This is consistent with toxic megacolon. This is a type of fulminant colitis causing loss of neurogenic tone and leading to severe colonic dilation as a result. The most common two etiologies of this include inflammatory bowel disease, with ulcerative colitis being a more common cause than Crohn's disease, and infectious colitis, which is commonly caused by C. difficile colitis, of which the use of antibiotics is a risk factor for C. difficile colitis. You can also get other causes such as ischemic colitis, radiation-induced colitis, colonic lymphoma, and graft versus host disease. In terms of radiographic features, on radiograph, we can see dilation of the colon and especially the transverse colon. Recall the normal diameter of the colon should be less than 6.0 centimeters. In the case of toxic megacolon, you can often get dilation of the transverse colon greater than 6 centimeters. You can see signs of bowel ischemia and pneumoperitoneum, which may suggest worse prognosis. On CT, you can see the loss of haustral markings. You can see pseudopolyps extending into the lumen, causing ulceration of the colonic wall. And you can see bowel wall thickening and edema. Here's the CT case of our patient. We see that there is markedly dilated and ascending, but particularly transverse colon. This is dilated beyond the 6 centimeter diameter. And we see that there is bowel wall edema involving the proximal ascending colon. So this is case number 7, a case of a toxic megacolon.